An alarming number of patients are leaving New South Wales emergency departments before treatment. Hi, my name is Patrick Hutzel from intensivecarehome.com, and today I'm going to elaborate why an alarming number of people are leaving New South Wales emergency departments before treatment and what's the solution to it. And I'll give you all the context around it. So on the 19th of March, there was an article on the ABC News with a headline, alarming number of people or patients leaving New South Wales emergency departments before treatment. Now, what does that have to do with intensive care at home? Well, it's got everything to do with intensive care at home. Let me give you some context. So in short, the article says, the analysis shows more and more patients are leaving New South Wales emergency departments before getting treated compared to pre-pandemic levels. Australian Medical Association New South Wales President Catherine Austin said hospital workers were expected, and I quote, to do more and more with less and less. New South Wales Health Minister Ryan Park said emergency departments needed to be kept for the most urgent cases. That's where intensive care at home has a solution. I also will link to the article, of course, in the written version of this blog below the video. The article continues, tens of thousands more patients are leaving New South Wales emergency departments before getting treatment compared to pre-pandemic levels, new data shows. So, and that's obviously very concerning, and part of it is simply there are not enough resources in emergency departments, i.e. doctors, nurses, simply poor staffing levels, and especially many patients that need urgent care are leaving the ED, right? And some of it also has to do that, there are so many bed blocks in hospitals now, including in intensive care, right, that EDs can no longer cope, and that's why patients are leaving and then probably coming back in a much worse state, assuming they can't get their health issues fixed with urgent care centers or their own GPs. So what's the solution to that? Well, we have two solutions here for that dilemma at intensive care at home. In 2023, 2024, we were actually delivering an emergency department bypass service as part of the Western Sydney Local Area Health District, their In Touch service. This was obviously in New South Wales, and the program has been a huge success. Unfortunately, the funding from the hospital went down, not because we weren't delivering on the service. Like I said, the service has been a huge success. And basically what we were doing is we were sending our critical care nurses into patients' homes or into some residential aged care facilities, actively keeping patients out of the emergency department. And the patient group that we focused on was, number one, palliative care. Patients wanted to die at home, of course. Number two, things like nasogastric tube changes, PEG tube changes, or nasogastric tube blockages, PEG tube blockages. We unblock those tubes or we change them depending on the situation. IDC, indwelling catheter changes or blockages, right? And suprapubic catheter changes or blockages, right? So we were doing all of that, but also we were, managing tracheostomy patients. We were changing casts, and that included doing home x-rays, especially when it came to nasogastric tube changes, right? Shout out to our friends from the mobile radiology service with Michael Montalto at the medical director there. They're doing an amazing job, complementing community services, including ourselves, to keep people out of ED. The other solution that we have to this problem is simply we are freeing up intensive care beds. There's lots of bed blockages in ICU that can be freed up with our service, intensive care at home, making room for ED admissions to go into intensive care much quicker. I'll give you another example and a case in point here. A few weeks ago, we had a family call us up, and they had their family member in an emergency department in Sydney right? It was their dad. And he spent 20 hours in the emergency department already. And their dad had dementia or has dementia and query sepsis, right? Or query infection. And the family said, look, he spent 20 hours in ED already. They want to admit him as an inpatient, but there's no bed available yet. Now, what people need to know there is the 4-hour rule in ED. So what that means is after 4 hours of being seen by the triage team, and if patients are getting admitted to the hospital as an inpatient, they need to be in an inpatient bed within 4 hours. Now, here we are talking about 20 hours, right? That's 5 times the wait time, right? So clearly the system is broken. They can't meet their own KPIs that they have set at some point. The solution for this particular family was they asked us, do you have a nurse that could look after my dad or our dad in the ED until he's been admitted to a hospital ward? Because we don't trust that the hospital are doing the right things. They're short-staffed. They just sort of leave him in a corner. Nobody's looking after him. You know, that's the state of hospitals in 2025 in New South Wales and probably around the country, right? And that is very sad. Hospitals and EDs were trusted environments once before, but that is no longer the case. You know, since the pandemic, nurses and doctors have left the industry in droves, driven out by, vaccine mandates and other environmental factors in hospitals that no longer wanted nurses, highly skilled doctors and nurses work in the environments, right? So it's a systemic issue that we have some answers to, not all the answers, but we certainly have some answers to. And from a financial perspective, with the New South Wales Southwestern Sydney Area Health District, where we were providing an ED bypass service, here are some numbers. To use our service during the week, Monday to Friday, would have cost around $250 to $300 for a call out for a visit. Now, a visit of this patient to ED would have cost around $2,000, right? That includes the ambulance ride. So compare that. We were basically eliminating 10 times the cost, right? It's a no-brainer. Same with ICU. Whenever we are taking a patient home from ICU with intensive care at home, we're not only freeing up the most sought after bed in a hospital, which is the intensive care bed, we're also cutting the cost by around 50%. An intensive care bed costs $5,000 to $6,000 per bed day. An intensive care at home costs around 50% of that. And we're freeing up, once again, the most sought after bed in a hospital. Furthermore, we are freeing up an intensive care bed, and we are improving the quality of life, and in some instances, quality of end of life for patients and their families in their own home, instead of them being stuck in an ICU, and at home they have holistic care and a holistic care model that's centered on the patient and the family, right? So we have solutions to what's happening in hospitals, and just lastly, coming back from a comment from Dr. Austin from the article, and I quote, "We're just seeing increased complexity, increased acuity in our patients and having to ask our workforce to do more and more with less and less," she said. That's worrying. That's very worrisome. And once again, we have the solution for that. So I hope that helps. I hope that helps you understand, what the solutions are for challenges within the system. We encourage New South Wales Health to contact us here at Intensive Care Home and work toward solutions in their emergency departments, but also the same in other jurisdictions. We have solutions for those systemic issues. So with intensive care at home, we're currently sending our critical care nurses into the home 24 hours a day. Therefore, we are providing a genuine alternative to a long-term stay in intensive care for ventilation, tracheostomy, home BiPAP, home CPAP, ventilation without tracheostomy, but also for adults and children with tracheostomy and without ventilation, home TPN, home IV potassium infusions, home IV magnesium infusions, IV fluids, and IV antibiotics. We're also providing ventilation weaning at home. We're also providing central line management, peak line management, Hickman's line management, as well as port management at home. We're also providing nasogastric tube and PEG tube management at home, as well as palliative care services at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, the In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going into the emergency department. Therefore, we're also in the position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs around $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per day. We're freeing up the most sought after bed in a hospital, which is the ICU bed. But most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. With intensive care at home, we're currently operating all around Australia, in all major capital cities, as well as in all regional and rural areas. We are NDIS approved all around Australia, TAC and WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the Department of Veteran Affairs all around Australia. Our clients and we as a provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025, and we have been achieving this level of accreditation since 2012. No other provider has achieved this level of accreditation in the community and has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. And if you're at home already and you're watching this and you realize you don't have the right level of support, or if you're stuck in an ICU long term, or if your family member is stuck in an ICU long term, I'll give you a real world example today. One of our first clients about 10 years ago when we first got started was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, it's dangerous and negligent having support workers looking after a client at home on a ventilator with a tracheostomy. That is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies or even dying if they don't have a team of critical care nurses looking after them 24/7. This is actually evidence-based that in the community, it's documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com, where it's clearly documented that only and exclusively critical care nurses with a minimum of 2 years critical care nursing experience can look after ventilation, tracheostomy at home safely. Think about it, in an intensive care unit in an ICU in a hospital, you wouldn't have support workers looking after a critical care patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? People have died because of this support worker model. So eventually this client found out about us, the ICU that he was going back to found out about us, and we were proving our concept with this client very fast. When we worked with the client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again. And we were proving our concept there very fast. We can do the same for you if you're not safe at home, which includes the advocacy for funding that goes along with it. We have always successfully advocated for our clients, otherwise we would not be in business. The same is applicable for those stuck in an ICU, similar to our case study, to what you're looking for. Reach out to us, we'll make it happen for you as well. We can take you through the right steps. And that is also why we're providing level 2 and level 3 NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge I've done an interview with Amanda Richards, one of our NDI support coordinators. I'll put a link to an interview with Amanda in the written version of this blog below the video. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. And if you're an NDI support coordinator or a case manager from another organization watching this, and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for nursing care for your participants and you don't know how to go about it and what evidence to provide, I encourage you to reach out to us as well. We will help you with the right level of funding and with the right level of advocacy. We're also providing NDI specialist nursing assessments done by critical care nurses with a legal nurse consulting background. If you're a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, and in Warragul in Victoria. If you have worked in critical care nursing for a minimum of 2 years pediatric ICU ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I have a disclaimer because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients do want the same staff coming over and over again because they're very vulnerable and very special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We're looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts, and if you're really keen on building relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can help you eliminate your bed blocks in ICU and ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is much more cost-effective than what you're paying in ICU and ED for, and you get the same level of care and you're freeing up your beds. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, home TPN, of course, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareatHome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareatHome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareatHome.com, and I will talk to you in a few days. Take care for now.